Good afternoon and welcome to review and republish your DSPT. My name's Alan Wilmot and I'll be running through the session this afternoon on behalf of the Better Security, Better Care team. If you don't mind, I'm just going to wait a few moments to ensure that everyone who's joining us has actually logged on. So just bear with us for a few seconds. Okay, so before we start, I'd just like to run through a few housekeeping points. Um, so the technical issues are that this is for care providers who have already published their DSPT in the past. So I am aware that some of you may not have been the person who did publish last time. So if you do have any questions as we work through, please follow the guidance I'll be running through shortly. Just to reassure you, attendees are on mute and can't be seen. So if you do have any questions, please use the Q&A function, not the chat. And if you're on a phone watching the webinar, then tap the screen to see the controls, choose more, and then Q&A. Any questions that we can't answer, we will come back to you, but make sure you add your email to the Q&A so that we know where to contact you. This webinar will last no longer than 1 hour, and you will be getting a copy of the presentation, including the links that we'll be running through throughout the session. So just one more thing I'd like to ask you. Prior to looking at the agenda for the session, we'd be really grateful if you could just answer a few questions so that we have some idea of who you are, where you are on your DSPT journey, etc. So if you could just respond to the questions that you see on the screen. What level is your service currently at? Have you personally used the DSPT? Are you a single site or multi-site organisation? And where did you hear about the DSPT webinar? So I just wait for everyone to be able to complete. Okay, so we're about 3/4 of the way through at the moment in terms of people who have responded. Right, so we seem to be stuck at around 91% of you, so I'm assuming the others don't wish to respond to the poll. So we can see that at the moment, the results are 10% of you are entry level, 19% approaching standards, 62% at standards met, 5% of you are at standards exceeded, and 5% of you don't know. So we've got a fair mix in terms of people, but the vast majority of you are at standards met. So thank you for that. That gives us a much better idea of where people are at in terms of the DSPT journey. So if we'll now end the poll, we can move on to looking at today's agenda. So what are we going to be covering today? Well, the first thing we're going to be looking at is logging into your DSPT. So how do you actually get into it in order to respond? Then we're going to be looking at reviewing your DSPT, bearing in mind that for many of you, it will be a year since you last looked at your DSPT and may not remember exactly what was in it, or it may not be reflective of the situation that you are in currently. We're also going to be looking at what's changed on the DSPT, so what might look or be different to when you last logged in, and then working through how you republish your DSPT, and finishing off with tips and best advice in terms of working with the DSPT throughout the year, what support is available to you, and we'll be providing opportunity for any questions you may have, as well as looking at what next steps there are. So let's move on to the program per se and start by looking at the process, an overview of the process in terms of what needs to be done. So you've already completed your DSPT once, hopefully. You're more than halfway there. So the first thing you need to do, obviously, is to log in. Then the task is to review and update your existing answers. Check if your previous responses has carried forward. Check that it still reflects your current reality. And then lastly, you need to make sure that you complete all of the relevant questions for your type of service and then publish. And just a reminder that the DSPT journey is from the 30th of June to the 30th of June. So you only be seen as being compliant with the DSPT if you publish once a year by the 30th of June. And of course, a quick reminder that it's possible to keep your DSPT up to date, that you don't need to only visit it once a year. Right, so if there are any areas as we work through this session that you're not sure of, there is lots of support available, especially if it wasn't you who published the first time. So in terms of what's available to support you, the support and guidance is all free and it's all official. It's supported by the Department of Health and Social Care and the NHS. And there is the Digital Care Hub, which provides online support, and there's also local support from the local support partners. And within the Digital Care Hub's website, you will find recordings of the webinars, you'll find frequently asked questions. There are template policies, as well as information on the helpline that's available to you. And I've already mentioned the local support partners. And if you click on the link at the bottom of the slide, that will take you through to where you can get information on the Better Security, Better Care program and all of the local support partnerships. So having looked at what's available, the first thing you need to be doing in terms of reviewing and republishing your DSPT is to log into the toolkit. And if you've forgotten your login details or you don't know them because it wasn't you last time, you can contact the National Support Desk in Exeter, which is both helpful and efficient, and it will be able to reset your login details, etc. So the login process is exactly the same as any other login process. So if we have a look at what it looks like when you go to DSPT. So if you want to get to this page, you just go to dsptoolkit.nhs.uk, as you'll see on the right-hand side of the slide there. And this is the login page. So you click on login on the top right of the page and you get the screen that's in front of you. So the login process is a standard login process. It asks for the email address that was used to register with the DSPT, and it asks for your password that you used to set up the account initially. And as you can see at the bottom of the left-hand side there is a forgot your password link. So if you know the email address but you've forgotten the password or don't know the password, you can click on forgot your password and it will allow you to reset it. Just a quick word about NHS Mail. On the right-hand side of the slide there, you'll see it says login with NHS Mail, which is another way in which you can log in using your NHS Mail account. However, if you do so, it will then, moving forward, always expect you to log in with your NHS email account. So if the person this is linked to leaves, then you will need to contact the Exeter Support Desk to reset the login details. Okay, so once you've logged in, what does it look like? Well, for single site locations, it will look like this. At the top of the screen, you'll see there is the blue banner that says complete your assessment for the relevant year. And underneath that, there is a progress bar, which will show how many items have actually been completed. And on this instance, it says 13 of 42, so it means there are still some questions to be answered. You can also view your previous publications or download the assessment. And then the toolkit consists of 43 mandatory questions. And when you're republishing, you only need to respond to the mandatory questions. When you first publish the DSPT, you respond to all of the questions in order to publish at standards met. The questions are grouped into the 4 sections as previously, and this is the view that you'll get if you logged in using your ODS V code. If you were a headquarters assessment previously, it will look slightly different. So the headquarters assessment view states on the blue banner, complete your headquarters assessment for the relevant year. You will also notice that it states in the grey box underneath the blue banner that this is an HQ assessment, and that you can publish for the selected branches, and then there's a tab there that says view branches. If you click on that, the drop down box will open and it will show all of the branches or locations that are linked to this particular headquarters assessment. And when you publish, you can choose which of your sites you're publishing for as a multi-site provider. So you can publish one DSPT that covers all locations or branches. Now, the amount of work that you need to do when you're republishing will depend on what level you published at previously. So if you published at approaching standards, then you'll have slightly more work to do in terms of republishing your DSPT. So you need to, in all cases, you'll need to review and update your existing answers. But if you only published at approaching standards, you will also then need to complete all remaining mandatory questions to reach standards met, because you cannot publish at approaching standards more than once. So you will need to reach standards met when you are republishing. If you published previously at standards met or standard exceeded, then the only thing you need to do is to review and update the existing answers to the mandatory questions. So a quick summary again of the key points. The task is to review, update and answer the questions. Your previous answers should still be there. So when you publish the first time, the answers should transfer across to the assessment view. But it's worth checking that progress bar that I was referring to in the earlier slide to make sure that they have all transferred, because if there have been changes to the DSPT infrastructure, it may well be that it hasn't all transferred across. And it will look different to what you've seen before if you've only published on one previous occasion. Don't panic. The first time you will have seen the social care assessment, which only has the questions relevant to social care. When you republish, you get the full assessment, and that includes all of the questions for organisations that are other than social care as well. That's why you only need to respond to the mandatory questions, which are exactly the same as you published on the social care assessment. So you only need to respond to the mandatory questions. So I mentioned earlier that the DSPT year runs from June to June. So each June they do review the DSPT, and so occasionally they make changes to reflect the current requirements, etc. So you will need to be aware that there could be changes. Last year there were changes to make it easier for multi-site publications, and they added a screen when you're publishing that's displayed to organisations not flagged as previously HQ. So if you registered with your V code, but you subsequently added other sites to the DSPT assessment, it will show you this screen asking you who you would like to publish for, and it gives you the option to choose the organisations. The existing functionality with HQ and the sites is unchanged. But when a non-HQ organisation that had sites added to their last publication selects Publish Assessment, this screen will be displayed. So what have they added? They've also added a new question on multi-factor authentication. So if you haven't been into the DSPT or you haven't published since last year, then this will be an additional question that you need to answer, question 453. And it's about multi-factor authentication, which is a tick box question, but it does require ensuring that we have done all that we need to do in order to be able to respond positively to the question. The reason they've added this question is obviously around enhanced security due to the heightened risk factors that we're all aware of. So let's have a quick look at what multi-factor authentication actually is. So multi-factor authentication is a way to make your online accounts much safer by adding extra steps to prove it's really you trying to log in, or it's really someone who's authorized to log in trying to log in. That's usually a text message, an email code, a fingerprint, or authenticator app, such as Microsoft Authenticator. And you will probably be familiar with this sort of process. For example, when you do online banking or logging into your social media, increasingly it's becoming common for most online services to require a multi-factor response. So the idea it being that it ensures we keep all safe by only allowing people to have access who should have access. So in order to respond positively to this question, what are we asking you to check before ticking the box to confirm compliance? So the first thing you need to do is to review your current systems and speak with your suppliers. You need to identify any potential issues that you may have within your organization. For example, staff sharing devices or logins, to make sure that a multi-factor response won't actually inhibit that, and you need to ensure that your systems and processes are established to make sure that security is as it should be. So you may identify where implementing MFA might not be appropriate. So if you already have other significant controls in place, or if it's too complicated for the particular system and the data that you're holding on that system. So you need to decide on your organization's balance of security versus usability. Anything that you decide you're not going to use multi-factor authentication for, you need to be noting that with senior management at director or board level, etc., and state the reasons why you're not doing that, either because the data is not sensitive and require that multi-factor authentication, or because of usability elements for the people that you employ, etc. So it's very much about horses for courses. It's important not to go overboard. The systems must be usable. And sometimes adding too many layers means people either stop using the existing systems or find workarounds. So it is for each individual organization to identify the appropriate level of security for each system you use based on the sensitivity of the information, the usability of that system, and indeed your appetite for risk as an organization. But bear in mind what I said earlier, that it is about identifying where you're not going to put in the security factors and making sure that that's signed off by the organization. Where appropriate, MFA should be implemented for all individual logins to systems. So wherever an individual is logging into a system that contains personal and sensitive information, ideally you should be having MFA. If you're not sure about how to do it, or you've got questions relating to that, then again, use the support that's available, either your local support organizations or your software supplier or your IT supplier. So having reviewed the questions and responded, updated the questions as appropriate, you should be in a position then to be able to republish. So what do you need to do? How do you need to do it? So again, the process, fairly straightforward. Log in, review and update the existing answers, making sure that you completed all the mandatory questions, and publish by the 30th of June. So a quick run through how it works. So in order to review and update your existing answers, you've logged in, you've got the questions up in front of you. The first thing to do is to check the ones that have got mandatory written on the right-hand side of the blue text. So as a social care organisation, you only need to answer the questions marked mandatory. However, if you answer more than the mandatory questions, you may be able to achieve exceeded standards. You can leave all of the other questions blank and it won't affect your publication. And in order to respond to the question and check the response that was there previously and amend if necessary, you click on the evidence item, which is the blue text, in order to see the question in full and the tooltip in terms of explanatory information relating to that topic. So review and update your existing answers. And if we click on the blue text, this is what it looks like. So the example question we've got here is 411. Does your organisation have an up-to-date record of staff and volunteers, if you have them, and their roles? So you can see on the left-hand side of the question that it is a tick box question, and that the tooltip gives you the best practice advice. It's what you need to do in order to be able to respond to the question. The comments box is optional. You don't need to put anything in the comments box. However, it can be very useful, especially for when someone goes back into the DSPT, especially if it's not you going back in, to see any explanatory information or the location of the information relating to the question. So it can be very helpful in terms of future DSPT publications. Once you've completed the question, in this case by ticking the box, you'll then be able to click on save and the question will show as completed. Okay, so just as an example of using the comments box here, same question, and you can see that in the comments box here it says staff and volunteer registered are contained in the HR files. So it's about the location, and it's got both hard copies and electronic versions, and it states where the electronic versions are stored and where the hard copies are kept, in this case in a locked drawer, etc. So let's have another look at the overview in terms of the process for the DSPT. So publishing your DSPT status, which means letting the world know where you're at in relation to your DSPT. So again, if we can go back one, please. So again, it's log in, review and update, complete all the mandatory questions as a minimum, publish your assessment, and then we can move forward. So having completed all the responses, you can scroll to the bottom of the page and you will see the publish assessment box at the bottom. So you've responded to all of the 43 questions appropriately. You've ticked to confirm your answers. Click on publish assessment. Remember, when you click on publish assessment, what will be published is your DSPT status and the date that that was completed, not what you've put in response to the questions itself. So if you were an HQ publication, it will look slightly different. You will see on the left-hand side of the slide here, you've got the progress bar, and above that, there is a box that states, this is an HQ assessment. Publishing this will publish for all the selected branches. So if you click on the blue View Branches link there, it will open up all of the branches that are available to be linked to this assessment. However, you will need to make sure that all of those locations or services have the same policies and procedures, and that they have the same IT systems and data security arrangements. Because when you click on publish for those services, you're saying that they have responded to the DSPT in exactly the same way as the HQ assessment. If that is the case, then you're able to publish one DSPT for all sites. Once you click on the publish assessment button, you may get a screen that looks like this. So you can see that in the red box there, it states there is a problem. So that means that one or more of the questions hasn't been recognized as being completed. And that could be for a number of reasons. It could be that you've just missed the question altogether, or it could be that you've entered your response to the question in the comments box rather than in the text box. However, if you click on the red text, it will take you to the relevant question for you to be able to review and establish what the issue with that particular question is. So, having published, you will then receive confirmation in terms of the publication. So you receive an email that confirms that you have published at what level and on what date and the time. And I just wanted to mention the blue link within the letter, that will take you to the DSPT register, where you can see what anyone can see about your publication. So this is the public register of people who have completed DSPT, and it will state what the status of the DSPT is, when it was published, etc. It won't show the content of the publication. So, in summary, a few useful bits in relation to working with the DSPT. When you first log into the DSPT and it takes you to the assessment page, there is a top toolbar, and one of the tabs available to you is the admin tab. And that allows you to manage the access to your particular toolkit. So assuming that you are the administrator, that allows you to manage users, add or edit the evidence in the DSPT, confirm the evidence, and publish the DSPT. However, it's possible for you to add other users, and you can add them as a member or a viewer. A viewer can view your responses to the questions in the DSPT, but they can't amend it. If you added someone as a member, they would also be able to add or edit evidence. So that could be quite useful, for example, for the IT questions. If you have someone in your organization who is responsible for IT, or if you have an IT supplier that you use, you may wish to get them to respond to the IT questions, for example, but they wouldn't be able to amend or add evidence in relation to any of the other questions. So it's possible to set different levels of access to your DSPT response according to how you wish to use it within your organization. So having published your DSPT, you can access the questions and the responses for future reference without logging into the DSPT. So you can download as an Excel file. And when you log into your DSPT, you will see that there is, underneath the progress bar there, a download assessment tab. If you click on that, the Excel file will download to your device straight away. You can then use it in various forms within your organization, or just to remind you of the responses that you made. It is also possible to save it as a PDF file. So in order to save it as a PDF file, you would click on View Previous Publications, which is the link above Download Assessment. That will then take you to a list of your previous publications. If you select the one that you wish to view, click on View Details, and that will enable you to save it as a DSPT. I will just mention that also it's possible here to download the certificate for that particular publication. You can see that the link for that is underneath the View Details link on this screen. So once you've clicked on View Details for your PDF version, if you then use Control and P on your keyboard to save as a PDF, it will take you to the print view. Make sure that you change it from print to save as PDF at the top of the screen. And then if you click on Save, it will enable you to download the PDF version. However you choose to use the Toolkit publication, it can be quite a powerful way to reinforce the organisation's response and expectations around the rights of the people that you support and employ, which at the end of the day is what data security is about. It's about upholding the rights of the people that you support and employ. So if you do have multi-sites, make sure you tell your branches that you have published, particularly if you've published on their behalf, and make sure they know what the content is using the Excel or PDF files available. Tell the registered managers, particularly ensuring that they operate in a way that matches the responses to the DSPT. Again, Download the certificate to prove the DSPT status. Add your DSPT status to your website. So, for example, within your privacy statement, just to reinforce how seriously you take people's personal and sensitive information. And you may want to consider adding a link directly to the DSPT status in the DSPT register that I referred to earlier. And increasingly, when you bid for tenders, etc., people are asking about your DSPT status, or specifically your data protection processes. So tell commissioners, tell the NHS partners, tell your IT suppliers that you have completed the DSPT. So how do you actually make it real within your organisation? The first thing is I would want to say is that it's really important that the DSPT is not seen as a tick box exercise, that it's intended to ensure your organisation has effective data and cyber security. So keep your DSPT up to date throughout the year. Make sure it reflects the current reality, and it will only make it easier to republish. Ensure that managers and staff understand what's expected of them. If you've said something within your DSPT about what you do and how you do it, make sure that that's what the managers and staff do in relation to data and cyber security. And enable your managers to access the information. So that's why we talked about the Excel spreadsheet or the PDF file. Why not keep them in a policies and procedure manual? And again, it will only be useful for CQC who are increasingly taking data and cyber security seriously when they review your service. So again, please remember that you're not alone in this, that there is friendly and expert support available from the Better Security, Better Care programme. And the full programme that's currently in place, again, a reminder from what we looked at earlier, reminder that everything is free and official, that there is online guidance with step-by-step films, webinars such as you're attending this afternoon, frequently asked questions, template policies, etc., etc., all available at the Digital Care Hub from that link at the bottom of the slide. So, for each area within the toolkit, there is guidance available, and that includes free e-learning course. So we often get asked about what training is available for frontline staff, and Better Security, Better Care has made available an e-learning course in 4 modules that covers all of the things they need to know, and it's really easily accessible. Each of the modules is 15 to 20 minutes, using case scenario material to help people to understand the actual practical application of data security. And it's for all staff, it's free, it's compliant with question 321 on the toolkit relating to the training of staff. So if you use this with your staff, you'll be able to respond affirmatively to the question 321. And there is additionally a more detailed training available for those who have responsibilities for data security and protection within your organisation. So if we can just move to the next slide, please, Cyrus. The data leads one. Again, 4 modules, easily accessible, relatable case scenario based program, and most importantly, it is still free. So if you feel you need it, there are template policies, etc., available also within the Digital Care Hub, but you need to make sure that you just make them relevant to your service. So not only to put in the name of your organisation, to make sure that it actually reflects what you do. So for approaching standards, there is a list of required policies that are available on the website there. I'm not going to run through them all in detail, but you can find them from the link that's at the bottom of the slide. For standards met, there are some additional required policies. And again, they're all available from the link at the bottom. And then in terms of your recommended documentation, there is some additional bits there, which I will just run through. The data security breach incident reporting form. And it's really important that as part of your response to data and cybersecurity, that you have a very clear breach incident reporting process, and this form can facilitate that. If you use mobile devices and you provide them to your staff, there is a template in terms of who you've assigned them to, your smartphone policy template, and a template suppliers list. So whatever you need in order to respond to the DSPT, it is available to you on the Digital Care Hub. So what further guidance, etc., is available to you? Digital Care Hub again has information on staff and workforce, IT and software suppliers, document retention and disposal, improving your security, mobile devices, and the national data opt-out. So again, in order to respond affirmatively to the DSPT, the resources are there for you to be able to implement within your organization. So if you do need any support, there is a local support partner within most locality areas within the country. And certainly you can visit the Digital Care Hub to access all of this stuff that I've been talking about. So what do you need to do next? Well, you can contact us for any tailored support that you require. And again, there are the 28 local support partners available. And there is the link at the bottom to be able to find your local support partner. And then for large care provider groups, there is a specific helpline available to help with issues around Right, sorry about that. I'm not too sure what happened there. I lost the connection for some reason. Um, okay, so let's move on to questions. Let's open it up for questions and see if anyone has any that we haven't been able to respond to as yet.
There isn't anything in the chat at the moment, Alan.
Okay, thank you. Right, in which case I'll bring the webinar to a close with one last task for you. Again, if you could just complete the poll for care providers, 4 simple questions, just to give us an idea of whether the webinar was helpful or not this afternoon. So what impact has it had on your confidence with reviewing and republishing your DSPT? How likely is it that you'll complete your DSPT in the next 3 months? How likely is it that you'll contact your local support partner? And would you recommend this webinar to a colleague? I haven't seen the poll appear yet, so I'm not sure.
Sorry, Alan, I was just responding to a couple of things that came into the questions.
The gremlins are at work. Okay, so again, if you could just respond to the 4 questions to give us an idea of where we're at this afternoon. Just wait for people to be able to respond appropriately.
There is a question from Brigitte just saying that she
Yeah.
rolled this out last year and she's asking whether she needs to share it with all employees or only new starters.
I would suggest as part of their data protection training, annual refresher, it could be useful just to use it as a point of reference.
And she's asking whether the IAR, whether it's mandatory to upload this.
No, it's not. You can use the text box. So with the IAR and ROPA question, it gives you a series of options in terms of how you respond. The last of those options is open the text box. So it's possible just to open the text box and type in the location of the IAR and ROPA rather than upload it to the system. I see we've had one respondent who said that it's reduced confidence. If you wanted to put in the chat or in the Q&A why that is, that would be really helpful. We may be able to remove your anxiety and make you feel more confident.
I'm wondering, Alan, whether there's been quite a few people this year that haven't published in the past and maybe they weren't quite sure what this was. So maybe
Right.
it's a
Okay.
little bit more than what they expected.
Quite possibly. Yeah.
There's a further question from Brigitte. She's saying that they uploaded 3 different IARs for different teams, and she's asking how that could be possible to be included in the comments box. I think probably just
Well, it's
referencing where
only
they're
the
stored.
location of the document. So you could say our IAR or our ROPA is in the data protection folder in the office, etc., rather than the content of the IAR and the ROPA. Okay, so we've got 95% response now. So the vast majority of you feel it's increased confidence. 9% it's made no difference. There's the one person who's a little more anxious about it, etc. But encouragingly, 78% of you say that you will be publishing your DSPT in the future. And 100% of you would recommend the webinar. So that's really helpful. Thank you very much. Okay, so if we end the poll there, we'll just finish off by saying thank you very much for attending the webinar this afternoon. And should you have any further questions, then use one of the support contact points that we shared with you during the webinar earlier on today. Okay, so thank you very much for attending and best of luck with your DSPTs.
Thank you, Alan.